My name is John Bush Jr. I am a respiratory therapist at the University of Cincinnati Medical Center. I've been employed there since 1996. I had prior positions there before I found out what I wanted to do and have a goal. And I've been a respiratory therapist since 2015. It is this amazing, amazing career choice that I chose. I also have the privilege of working for the NFL for the emergency action plan for use for the Cincinnati Bengals, and I am part of the airway management team, and it is an awesome position. It was a situation with a Pittsburgh Steelers player when he had got injured. And the Bengals came to UC and said, since you're a level one trauma center, we need you to handle our medical emergencies. So with that being said, one of the head doctors who was in charge, Dr. Bill Knight, he says that I'm going to need to direct my staff. So he says I'm gonna need my airway doctors, my neuro doctors, my RTs to manage the situation, just like we would in the SHRU of the emergency room. So with that, that's how he got respiratory therapists involved. So he put an email out to our department, and he asked for two primary and two backup RTs who were interested. And I just followed up with the email, and I was selected as one of the primaries. And this was 2018. So we have been down at the stadium practicing for worst case scenarios ever since, which we never wanted to happen. But with the familiarity that we had in the same team, because the Bengals love familiarity, and so it gave us a little familiarity and confidence within each other. So if something did happen, and on top of that, we work every day with each other, so we
Mhm.
all know our strengths. We trust each other, and we was all collected at the right place at the right time for that moment. You know what? I just simplify and I tell them I'm part of the airway management team. I help deliver oxygen via oxygen tanks and masks. But if something happens very bad, that's when I go out and I'll assist the doctors treating the player. Initially came to UC to work in 1996. I was 21 years old. I didn't have an idea what I wanted to do. I just wanted to work. And while I was a patient transporter, there was an opportunity for employees with little to no college experience to attend Cincinnati State as a collaboration. And the collaboration, it was a program called the Health Career Collaborative Program. And it involved like a few hospitals around the area. And they would select a certain group out of each hospital to go to attend Cincinnati State, and also go through our prereqs together. With me having relationships with a lot of employees at the hospital, nurses, doctors, and all, I felt RTs were the coolest. So I said, and also I said, well, you can't treat a patient if they're not breathing. So I said, respiratory therapists will be great for me. So that's when I signed up for the program and completed it and graduated Cincinnati State in 2015, uh, which is an excellent program. Cincinnati State has one of the greatest respiratory programs in the region. They are sister programs with UC Claremont, in which they run the same curricular, and basically they produce some amazing respiratory therapists. I encourage people all the time, especially now because of what happened just recently. A lot of people are seeing what respiratory therapists are and what they do, and there are a lot of young staff members at the hospital who are inquiring about it. And I just persuade them and push them in that direction and try
Mhm.
to give them information to get them where they need to be. Every day. Like, I just try to make an impact on patients, and I have
Mhm.
so many great experiences and stories throughout. But this year, particularly, I received a quarterly award. It is the Pride Award at the University Hospital, which is um, given to staff, and you're nominated by a peer or someone. But this particular one was I was nominated by a patient. This patient was in intensive care unit. Let me reflect. And it was a moment. It was a dark moment for their family, and I always just try to be light for that dark situation. And I just gave them a reminder of love in that time. And the wife, she actually wrote a letter that reached the top of the hospital, and it was emotional letter that for the care and for the message that I gave to their family in that moment. And not only that, her son, he also wrote a letter, and it was heartfelt. I mean, every time I read it, I get tears, and it's like when they nominated me for when I actually went to the award ceremony, she actually read the letter, and that right there is what it's all about. When you hear it come from patients and families, how well you've done and how you changed their life and made them feel better, it's priceless. When you're a first hire as an RT at the university hospital, you start off orienting through all intensive care units. And once you're oriented through all intensive care units, they'll place you in a rotation pool because we have core members where you can stay in that area or you can rotate throughout. So with me having a relationship with a lot of people throughout my other career, throughout my other profession through there, I feel rotating is my strength because I know everyone and I get along well, and it's more of a team effort. So um, I rotate through the medical intensive care unit, the surgical intensive care unit, emergency, cardiovascular, and I think it just increases my knowledge on all aspects of healthcare when it comes to respiratory therapy. It definitely gave me a level of confidence that I know that what I'm doing. Um, I have relationships with those doctors, those physicians, with RTs, and just been through this situation that we do every day. I mean, this is what happened down there on Paycor that night, January 2nd. Um, Me ventilating, oxygenating the player is something that I do every day. It's happened to just have the biggest stage that you can actually have, and we actually got a great result out of it. I would say my passion is seeing patients get better, make it out of the situation that they came in with. That is my passion. I'm there to help heal, whether it's breathing treatments, breathing exercises, anything in my profession that I was taught to help that patient breathe better. That's one of the first choices I chose to do this. I said you can't treat a patient if they're not breathing. So if I can help them breathe better and see them get better, that's the cherry on top. I think my purpose, I look at it well before I even came to the hospital, like even just the whole journey of it, not knowing what I wanted to do when I came, like when I first got hired. It's like, I didn't have a goal, I didn't have anything. So from all of this, I realized that I do have a purpose. Like this was my purpose all along. I just had to walk the journey and meet the people I met and treat the patients I treated and just take it one step at a time. Even this year, I couldn't have predicted it. Since January 2nd, it's like I'm literally living a dream. So, I always knew I had a purpose, but to actually see my purpose now, that's amazing. Yes, I have. I saw him after he was extubated. I actually went to his room and talked to him and told him because on the field the whole time I was letting him know that my main goal was to get him home to his mom. I was looking at him like he's my child. I have a 29-year-old son. He was 24 at the time, and I have to get this child home to his mother. And when he was extubated, I actually was working that day, and I said that I need to hug his mom. So I called Dr. Knight, who informed me to come up to the room, and it was a couple of players, a couple of trainers, his dad and him, and I just let him know that I was breathing for him the whole time. And he smiled from ear to ear, and I told him, I said, I was going to get you home to your mother. And I pointed to his mom. It was like just one of those moments. And then I got to see him again a couple of months ago. He was on his tour, his CPR, AED tour. We were like the third city that he came. And I was actually doing a clinic with one of the doctors who was on the field as well at that time. His name is Brett Betts. And he actually had a sports medicine clinic. And I participated in the airway management part. So Lamar was next door, and we went over, and I got to talk to him and just told him how proud I was of him. And he posted me on his IG page, which is currently on, because he visited the hospital before he came over to his CPR class. And he also visited the room that he was in and took pictures with family members that were in the room. And like, he's just an awesome young man. But yeah, I got to meet him there and just let him know how proud I was. And, the things that he's going to do are going to be amazing. Hopefully, with this situation, other teams can see the importance that we have as far as airway management. And it also just depends on the trust of the physicians that can trust RTs in the very critical situations, and use us where in more roles as far as sports or any other Elite Four medical services. A lot of people, not only athletes, but a lot of people don't know what RTs is still. So hopefully, with my story, and WCPO Channel 9 did a great interview as well with me, and hopefully they gave light to our profession. And like I said, I try to encourage a lot of the other employees, and just anybody who meets me, just I let them know how important our role is as RTs, and just basically what we do. RTs have a range of responsibilities, from teaching to hands-on. And it's a broad perspective of what we do. Very underrated profession, but hopefully this brings a little more light for us in the future with other roles once they get to accept us in it. Just stay diligent. Just stay consistent. Don't get discouraged. There's going to be moments where it's like your relationship with certain individuals can alter your treatment, but you have to realize your main purpose is for that patient. It's bigger than you. And just consistently learn. Healthcare is always evolving. So things is always changing. We have equipment that we use, that's always changing. New ventilator updates, anything. Like, always stay fresh and stay relevant. And don't be afraid. Like I said, before this position, I wasn't even going to sign. I was intimidated for the years of experience that I had as an RT. I had lack of confidence. But for someone to have confidence in me, it's like I offer that to others. I say, look, you have to be confident. Just be the best you can be. Yeah, I would like to give a shout out to my coworkers at University of Cincinnati Medical Center, as well as the team that I have at Paycor for the airway management team. Ron Carter, I'm gonna say Sam Valance, Kenzie Kingsover. We've also had a few members that had to step down: Beth Donovan, Michael Phillips, and Sherry Muster. We're all as good as each other. We make each other better. Physicians, Wood Curry, Brett Betts, Jason McMullen, Robbie Paulson, amazing people, amazing coworkers. I wouldn't trade them for the world.